Major depressive disorder. Depression is a mood disorder that causes a persistent feeling of sadness and a loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal, day-to-day activities, and sometimes you may feel as if life isn't worth living. More than just a bout of the blues, depression isn't a weakness and you can't simply snap out of it. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy, or both. Major depressive disorder is the leading cause of disability in the U.S. for ages 15 to 44. Major depressive disorder affects more than 16.1 million American adults, or about 6.7% of the United States population, age 18 and older, in a given year. While major depressive disorder can develop at any age, the median age at onset is 32.5 years old, more prevalent in women than in men. Major depressive disorder is an extremely complex disease. No one knows exactly what causes it, but it can occur for a variety of reasons. Some people experience depression during a serious medical illness. Others may have depression with life changes such as a move or the death of a loved one. Still others have a family history of depression. Those who do may experience depression and feel overwhelmed with sadness and loneliness for no reason. Here are some contributing factors that may increase your chance of major depressive disorder: abuse, past physical, sexual, or emotional abuse, certain medications, conflict with family and friends, death or a loss of a loved one, genetics, major events such as a job promotion, other personal problems, serious illnesses, or substance abuse. If you have been experiencing some of these following signs and symptoms most of the day, nearly every day, for at least 2 weeks, you may be suffering from depression. Persistent, sad, anxious, or empty mood, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, moving or talking slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering, or making decisions, difficulty sleeping, early morning awakening or oversleeping, appetite and or weight changes, thoughts of death or suicide attempts, aches or pains, headaches, cramps, or digestive problems without a clear cause and that do not ease even with treatment. Treating and managing your major depressive disorder. Medication alone and psychotherapy, cognitive behavioral therapy, interpersonal therapy alone can relieve depressive symptoms. A combination of medication and psychotherapy has been associated with significantly higher rates of improvement in more severe, chronic, and complex presentations of depression. Cognitive behavioral therapy, CBT, is based on the premise that patients with depression have thinking that is characterized by dysfunctional negative views of one's self, one's life, and one's future, the cognitive triad. Thus, a clinically depressed person is likely to believe themselves as being incapable and helpless, to view others as being judgmental and critical, and the future as being bleak and unrewarding. CBT is a structured and dyadic form of therapy that focuses on helping individuals identify and modify maladaptive thinking and behavior patterns. There is research evidence supporting the effectiveness of CBT with individuals of all ages. It is also considered to be efficacious for the prevention of relapse. Pharmacological treatment. Antidepressant medications work well to treat depression. Sometimes different antidepressant medications would have to be tried before finding the one that works best for the individual. Medications that have helped a close family member of the individual are likely to help the individual seeking treatment as well. Antidepressants usually take some time, 2 to 4 weeks, before they impact the symptoms. Appetite, sleep, and concentration typically improve before mood begins to lift. It is important for individuals receiving treatment to give the medication time to work before deciding that the medication is not working. Antidepressants can have side effects, but many side effects may lessen over time. Talking to a healthcare provider about the side effects and not discontinuing the antidepressants by oneself is important. Stopping the medication early when one starts feeling better is also not a good idea. Stopping the medication suddenly can cause unpleasant withdrawal symptoms and can be unsafe. It would be best to follow the prescribed course of time and then to stop the medication slowly and safely with the help of a healthcare provider. Prognosis for major depressive disorder has significant potential morbidity and mortality, contributing as it does to suicide, incidence, and adverse outcomes of medical illness, disruption in interpersonal relationships, substance abuse, and lost work time. With appropriate treatment, 70 to 80% of individuals with major depressive disorder can achieve a significant reduction in symptoms, although as many as 50% of patients may not respond to the initial treatment trial. 20% of individuals with major depressive disorder untreated at 1 year will continue to meet criteria for the diagnosis, whereas an additional 40% will have a partial remission. Pre-treatment irritability and psychotic symptoms may be associated with poor outcomes.